Good evening, everyone. Good evening. I hope everybody is doing all right this evening. My name is Isaac. I am currently acting as the digital strategist for Woke Votes, and we are having another wonderful conversation this evening about how you can get involved with the vote. Tonight, we're going to be focusing on healthcare and how it relates to your vote. We've got a wonderful panel lined up for you this afternoon, and we're just going to have a really, a family conversation about what we need to do to get ourselves prepared during this time of a pandemic and things that we need to be aware of. I want to make sure that I take the opportunity to thank the Wave USA. The Wave USA has been our partner for these conversations. This is the second in the series that we've done, and they've been a wonderful partner with helping to pull these things together and make sure that we have lovely conversations like this that are going to be focusing on your vote. As well, I want to make sure that I shout out my people here at Woke Vote. So wokevote.us. This is where I want you all to go as soon as we're done with this conversation. If you hear something that is going to be beneficial for you, that stirs your spirit about something, go immediately and go commit to vote. Wokevote.us is where I want you to go. Go click on that website and go commit to vote. We need as many people as possible to make a commitment that they are going to show up at the polls and let their voice be heard. So we want to hear from you, and we want to make sure that you all are doing your responsibility to be a part of this wonderful conversation, not just tonight, but continuing the conversation onto the polls. Anyway, that's enough about me. What I do want to do is bring on your host for tonight. This is a friend of mine, been a friend of mine for years. Not only has she been in radio, and she is a wonderful radio personality known as Lady Wu, but she's also in the healthcare profession herself, dealing with mental health. And she is the perfect person to come and host this conversation tonight as we begin to talk about healthcare and how it relates to your vote. So I'm going to get out of the way, and I'm going to let these dynamic ladies come up here and take the stage. But the next voice you're going to hear is going to be Lady Wu. We're going to let her take it away. Thank you so much. Talk to y'all later.
Good evening. I am Lady Wu, and welcome to the conversation on tonight. It's such an honor to be here, facilitating the conversation and talking about what's important in 2020. November 3rd is right around the corner. We were here with you the other night talking about the census and how important it is to society, to Birmingham, to this area. Tonight, we are taking the conversation to a different level and talking about healthcare and how it affects us. How are we affected by healthcare, physical healthcare, mental healthcare, holistic healthcare? And I have some awesome ladies who are going to help us with this conversation tonight. Going to get them pulled in and get their information so that you can know who they are and exactly what makes them qualified and more than capable to have this conversation. The first person that I will introduce is Dr. Akila Jefferson Shah. Dr. Akila is an assistant professor of pediatrics at the University of Arkansas for Medical Sciences College of Medicine, Allergy and Immunology section. Prior to this appointment, she was faculty at University of California, San Diego, and Rady Children's Hospital, San Diego, in the Division of Allergy, Immunology, and Rheumatology. She completed her allergy and immunology fellowship training at the National Institute of Allergy and Infectious Diseases at the National Institutes of Health in Bethesda, Maryland, and residency in internal medicine at the George Washington University Hospital in Washington, D.C. She received her medical degree from Tulane University School of Medicine and her BA in bioethics from Brown University. Dr. Jefferson Shah is also an expert in health policy and bioethics, completing postgraduate training in both fields at Georgetown University and the National Institutes of Health, respectively. In addition to clinical care, her work focuses on the intersections of healthcare, clinical research, health disparities, health policy, and ethics. I welcome to the screen Dr. Akila. How are you?
I'm well. Thank you for having me.
Absolutely. Our next doctor, and we're going to talk about this intro and this bio and some of the stuff I heard. I'm already excited. Our next doctor is Dr. Celeste Reese Willis, aka Dr. Celeste, is a board-certified family medicine physician, a leading expert in urgent care, a nationally recognized speaker, and Amazon best-selling author. Her passion centers around empowering her patients and providing excellence in healthcare through her telemedicine concierge medicine programs. She is a sought-after media expert regarding seasonal allergies, influenza, hypertension, COVID-19, and preventative care. And she consistently educates her patients via her online TV show each Sunday called Let's Chat. You can follow Dr. Celeste on her social media platforms to learn how to stay healthy, vibrant, keep loving your body into your own vitality at Dr. Celeste MD. So last but not least, Dr. Celeste, in her bio, she mentioned vitality, and the name of my show is Vital. So I'm so happy to be reading these accolades and all of the things that both of you have done. That makes me know that I'm in good company. So I don't have on a white coat because I'm a doctor. I have it on because I'm talking to doctors and I like to look like where I'm going. Okay. So I'm just honored to be a part of this conversation. Isaac mentioned me being in the mental health field of medical services. I am a licensed therapist, and we'll start there with mental health and COVID-19. So as professionals, and just seeing where we all are in the middle of this pandemic, that's not a hoax, right? Super real. Okay, so as long as we're on the same page. If one of you would have said no, I would have been like, shut it down, it's over. So we know that it's not a hoax. And we have seen the effects that it has had on everybody around us. What would you all say to some of the things that you've seen mental health wise in your practices and in your personal life as it relates to COVID-19?
Well, if I can go. So the first thing that I would say is that it's been amazing the effect that isolation has had on people all the way around, in terms of if it's someone or a patient who at baseline deals with the challenge of anxiety or depression, and you put them in an atmosphere wherein they have to stay being socially isolated, that actually compounds the symptoms that individual will feel. COVID-19 has also caused some people that have baseline issues wherein they may not have been even diagnosed with depression or anxiety, that are being newly diagnosed because of the effect of this social isolation and quarantining. And that's from all age groups, from kids at 3-4 years old all the way to older patients that are well over 65, 70 years old. So the impact has been just incredible, unfortunately.
Yeah. Thank you so much for that. I've seen those same things, people dealing with new symptoms with the depression and isolation. So I can totally relate to that. Dr. Keela?
The other thing I would add, and I 100% agree with Dr. Celeste, is this idea of people feeling like they're out of control and that they've lost control of their everyday lives. In addition to being bombarded with so much information, so much misinformation, without a really good process, a really good way to process all of it and to know what's real and what's fake, what's a hoax and what's not. So really, I think dealing with that too and finding ways to kind of unplug yourself from all that information overload is really, really important, to figure out ways to just relax your mind at certain points in the day, to turn off Instagram, to turn off Facebook, to get off of Twitter and really recenter and feel that sense of control back in your life again. So
for sure. Awesome tips. What are you both doing in your personal lives? Like people, you trust your doctor. So you trust your doctor to do what they're telling you to do. So what are some things that you all have done throughout COVID to make sure that you're taking care of yourself mentally?
So I'll go first. I do yoga most days. And I just take time. It's really part of that recentering, feeling like I'm a little more relaxed, feeling like I'm a little more in control, and also really building strength that's kind of outside of all these everyday things that I'm doing. So I encourage everyone, all of my patients, to exercise or to find some activity that you really enjoy doing. For me, it's yoga. For someone else, it may be something different. And to really focus your attention on that.
Okay. Dr. Celeste?
So I agree wholeheartedly with Dr. Akila, and exercise is my number one thing that I encourage my patients to do, to try to not only stay healthy, but to deal with stress. And that's one of the things that has actually been a challenge of mine, because I usually do that at a particular gym. It's a smaller gym, and there's a program that we normally do. So I've had a huge adjustment in that particular capacity, as I'm not comfortable going into a gym with other people in it and working out yet. So I've literally rearranged my workout schedule to try and be there midday when there's no one there, or on the weekends. I work out Saturdays and Sundays a lot. My husband and I do on the weekends to try and avoid other people, but to make sure that we get that in, right? To relieve stress. I've had to do a lot more I usually actually love to run, but I've had to do a lot more walking in the neighborhood, etc. And I encourage my patients and everyone to find some form of exercise, because exercise does so many different things that helps to relax you. It decreases stress. It increases your happy hormones, those hormones that make you feel alive and at a higher point, and to decrease a sensation of anxiety and stress and depression. It's a stress relief, basically. And so I encourage everyone to do that, but to find an activity that they can do alone and that they don't necessarily have to do in a group. But if you do it in a group, encouraging them to make sure that they do it safely.
Absolutely. So doing it safely and thinking about how safe you can be. I think we're at our safest when we're like this, and when we're in our homes and we're able to communicate this way using social media and different platforms. But we still have to live. The world is still happening, and especially in the medical health field. So you all have the background of allergies and crisis and emergency, which is where all of us are right now. Oh, it's just my allergies. Oh, I look like this because it's just my allergies. Oh, I'm just here because I'm having some symptoms, but nobody's wanting to really admit that, oh, this is COVID. So let's go there. Both of you have worked throughout this whole pandemic, right?
Yes.
Yes.
What are some things that you've seen when it comes to people, so I'll say this, the credible piece of all of the news and information that we've gotten will make some people think that COVID is not real, or that, it's too difficult to tell the difference between COVID, a cold, and the flu, or walking pneumonia, things that we're aware of already. So when people get to you, what are you seeing and what are you doing?
So one thing I think about are really patterns. So for instance, for allergies, when COVID really was on an uptick back in March, that was really the beginning of spring allergy season. And so all of my patients, and myself included, were kind of concerned when they got their stuffy nose or their runny nose or their sneezing. But then I always try to bring it back to patterns. So if you're an allergic person who always has allergies the same time of the year and you always have the same symptoms, the most likely story is that that's what's going on, right? Particularly if you haven't at that point had any really known exposures, you really weren't out and about, you were just at home and you got a sneeze. I would go down that direction. But at the same time, we do have to be very aware and cognizant that there are people who have very mild symptoms who have COVID-19, who are asymptomatic and have COVID-19, and really encouraging people, if you're worried about it, to get tested. That's the safest thing to do, to keep yourself and your loved ones out of harm's way. So, it's kind of playing the odds a little bit, I guess, to think about all the possibilities, what the most likely story is, but then also in the back of your mind, remembering that this other thing is out there and that we do need to take it seriously, and we do need to keep ourselves as safe as possible.
Okay. Thank you, Dr. Aguila. So Dr. Celeste, they've been coming in since March, dealing with COVID-19. I don't know what this is I'm doing. I don't know what I'm feeling. I just don't feel good, and I needed to come in.
Mm-hmm.
What have you been doing? What have you been seeing?
Well, I definitely have seen all of that. I've seen people who have come in and presented with allergy symptoms, seasonal allergy symptoms, and thinking, oh, I know that I don't have COVID-19. I've unfortunately seen some patients that thought that and were actually positive. So the first thing I would encourage everyone to do is, if you're having those symptoms, especially that myriad of symptoms, definitely get tested. Secondly, I encourage all my patients to make sure that they stay on their maintenance medication, especially people with seasonal allergies and asthma, because what we know is that if you don't take those maintenance meds, we know that the things that the ragweed this time of fall will help to trigger, right, your sinus symptoms. So we want to make sure that we stay on the meds that will help to decrease the likelihood that you'll be triggered by that seasonal change. But staying on those maintenance meds is so, so important to try and help decrease some of the crossover that you're going to get in terms of symptoms when you're looking at allergy or chronic sinusitis symptoms versus COVID-19. So staying on those maintenance meds, if there's any question or doubt at all, definitely go and get a test. And you're doing this, and I love what you said, Lady Wu, you're doing it to help protect your loved ones more than anything else.
Yeah. So thank you both for sharing that. When I think about people getting, going into the emergency room or coming into the crisis clinics, I can say crisis clinic, but coming to you all in an emergency, or, after their maintenance meds aren't working anymore and they realize, okay, so there is an issue with COVID-19, and just thinking about all of the fake news that we've gotten. People have been told to take Clorox. They've been told to sniff Lysol, just different things that we've heard from people to do. We know that there's no cure for coronavirus or for COVID-19. We know that. But have you all been able to give anything to help with the symptoms? I've heard and even experienced the difficulty that comes with the symptoms. Like, what could you speak to about that?
So that's sort of a hard question. For symptoms, whether it's things like a fever, then you might want to take antipyretics like Tylenol or something like that to decrease fever symptoms. If you're having muscle aches, similar things to regular cold treatments that you would do for symptoms, making sure you're drinking enough fluids and things like that. There's a little bit of discussion, I would say, out there about certain vitamins that may be helpful, like vitamin C and zinc and vitamin D, but there's not really any great evidence to back all of that up necessarily. If you're deficient in certain vitamins, like vitamin D, then you should certainly make sure that you are repleting that either through your diet or through supplements. Making sure just your baseline health, as much as possible, is at a good level, so that if you are kind of impacted by an insult like COVID-19 or really any other virus, we're going into flu season, right? We want to be in the best place that we can be in to fight those viruses, to fight any of those insults from the outside world. The other thing I would say really is, if symptoms are not manageable at home, you're having difficulty breathing, you're having an uncontrolled cough, things like, you need to be seen by a doctor, you need to be seen emergently to make sure that it's nothing more serious going on, so that you're getting the correct medications and not just trying to kind of temper things at home on your own.
Okay. Thank you for that. Dr. Celeste, did you want to add something to any relief for the symptoms?
No, I echo what Dr. Akila shared in that we typically will use, Tylenol if someone has a temperature. There are certain over-the-counter medicines if someone's having cough and things of that nature that we may prescribe to patients. And depending on, everything, it depends on the patient and what symptoms they're exhibiting, but there's not a generalized, oh, you're positive, so let's give you this, this, and this. It depends on the patient and their story and their history and what's going on with them. I will echo what she said about the vitamin support, though. I am a strong proponent of that. And in that, vitamins help to boost your immune system. And boosting your immune system at this time is very important for everyone to do at baseline. Now's the time that you want to make sure you're drinking plenty of water. You want to make sure that you're getting protein intake. You want to make sure that you're getting plenty of rest. These are all the things that help to support your immune system and help you fight off a virus if you come into contact with it, and to help you feel better if you are suffering with COVID-19.
Great. So with that being said, we all look alike. We look alike, it's a beautiful thing. We also know that a lot of our insides are different. They're rather compromised when it comes to pre-existing conditions and underlying issues that sometimes have been treated, other times may not have been. And this is where this thing gets political. You start talking about the African Americans as we've been politicized as, and how things affect us, things like COVID-19, and how many African American people have lost their lives or have had some horrible symptoms and hard recoveries because of things that are underlying for us. Why is it that we've been so much affected by COVID-19 and this pandemic?
So, sorry, Dr. Celeste, you can go first.
So I was just going to share, it's directly linked to the comorbidities that are disproportionate among African Americans, such as diabetes, such as heart disease, such as, asthma. Any of those things, even down to vitamin D deficiency in terms of a patient who's COVID positive that's in the hospital. There's some new studies that are out in relation to that. And vitamin D deficiency is more common in our culture than in other cultures.
Okay.
We don't know, and there's not a lot of research to support for us to have factual evidence to give you at this moment. I will let Dr. Shaw to speak on that a little further, but there's not anything there's not a lot of research that has been done to date to study. I think there needs to be research to study why it is that COVID-19 is affecting our culture in this way. But it is directly linked to those comorbidities that you see them in stronger percentages in our culture. And so I'll let Dr. Shaw speak a little more on that.
Okay.
All right. And the other thing I would add is that it's directly linked to social determinants of health and structural determinants of health. So Black and brown people in the US, we're frontline workers, we're essential workers. So at the beginning of the pandemic had much more exposure to the virus at that point. And, the rates of illness were much higher in those populations than in others who had the, I would say, privilege of being able to telework or stay home or things like that. So, that adds to it. There's a lot of evidence about overlap between social vulnerability, which has to do with kind of housing, multi-generational housing, close quarters that you live in, where you can't necessarily physically distance if someone else in your household becomes ill. It tends in a lot of Black and brown households who become ill, that one person, it spreads to the rest of the family. And it's, for that reason. So there are lots of social factors there that are underlying everything that's going on. And I would argue that a lot of the social factors are part of the reason why Black and brown people tend to have higher comorbidities at baseline anyway. So if you think of things like hypertension and obesity, there are food deserts. There are places where we don't have good options for healthy fruits and vegetables, and you're forced to eat foods that are not as good, more sugary foods, more high calorie foods, therefore, thereby kind of increasing obesity in certain communities. Right. So I think it's all linked. There have been lots of people trying to figure out other reasons, biologic reasons, which, may be there too, but there's plenty of studies with other diseases to show that social determinants of health drive up to 80% of health outcomes. And so I think, we have to really pay attention to all that's underlying all those structures in which we live that make people more susceptible to certain illnesses.
Right. So you all are speaking more to the science behind how people are affected by COVID-19, and people in particular being African-American people. So where this conversation is tailored to speak more to the medical side of it, it seems that medicine, medical practices have all become politicized. And I want to start just by asking you how you feel about that part of it. I'm just doing my job. I'm Dr. Celeste. I'm Dr. Akila. I'm waking up. I'm going pulling charts. I'm ready to see my clients. But then I think my patients. But then I think about how this thing, it's political now. How does that make you feel?
I'll start. Sorry. I think it's unfortunate, to be honest. I think, number one, I'm of the mind that everyone should get good health care and that everyone should have access to what they need to get testing, to get treatments, to have access to things like investigational medications, to have access to research into new treatments and vaccines. And the way that a lot of things are going right now, that's not happening for political reasons and for other reasons. So I think that's unfortunate because in the end, patients suffer, right? And the people who suffer most are the ones who are already most vulnerable, who tend to be poor in the United States, who look like us mostly in the United States. And so it just further exacerbates other underlying issues that we've been having as a nation. So the other thing that bothers me is when you politicize medicine and research in particular, it really leads to mistrust of the entire process. And so as we come out with, new medications and vaccines and things, this whole politicization of it makes people feel even more wary of the process in which all these new things came about and the people who are pushing them. And that in the end is going to hurt more people than help more people, I think, too.
Thank you. Dr. Celeste?
Yes, I definitely agree with what Dr. Keela shared in terms of the way that COVID-19 has been politicized has caused us as physicians to feel when you go through a certain level of training to be able to treat a patient and actually elicit medical care to a community.
Mm-hmm.
So when especially if you've had experience, patients have trusted you, when you get misinformation that's out there, you spend a large part, or at least I have spent a large part of your time having to undo whatever damage is done by the misinformation that they've heard.
Yeah.
It's sad to me for several reasons. And the first is that it's sad and it's frustrating as a physician to be in that position because you're trying to help people and they're doubtful of what you're saying because of something they heard, on social media, because of politics, etc. The other part is there is a lag in care, and there are some patient groups that are leery of physicians. I've never had that experience before prior to COVID-19. Leery of, oh, are you sure it's real? Are you sure it's not a hoax? Oh, I don't need to be tested. And when they're Black and brown people that look like us, who aren't being tested, who will take the virus, especially when you follow, hundreds and thousands of patients during this time and you've seen what COVID-19 can do to a family and to a community, especially in one of those, what Dr. Keela shared earlier about, households where they're multi-generational households where you have, 5, 6, 7, even 10 people in one household. One person gets it and it can devastate a family. We've seen several news articles about how COVID-19 has devastated families all across the nation.
Right.
From California all the way to Georgia, up to New York, and back down to Florida. So it's frustrating. We continue to work in it because we know what our purpose is. And we know that our purpose is to help the Black and brown people that look like us, as well as everyone in the community for that matter, but most especially the group that's being ravaged by it. And you're trying to educate them and test them and assess them to help them be better, but getting them to understand if they're not tested, that they can take this home. They may be fine, but they'll take it home to their grandmother, whom they love and adore, and it kills her.
Right.
Do you see? And so there's a huge disconnect there that you have to kind of fight through all the politics and get to be able to treat your patients. So it's frustrating. We won't stop doing it because it's why we're here. But it's just very sad the way that people have utilized COVID-19 for the purpose of politics or even for finance, for that matter.
Wow. Thank you thank you both for answering the question the way that you did, such depth. And, it took me into your world. Like, I'm here to serve you and to make you feel better, to educate you on what I know. I'm not, for you all, this is not like, I'm sure coronavirus it started, this one, it was novel. So 2019, but when you all learned about influenza and all these other pandemics that happened before now, you learned about these things. So as your patient, I want to be able to trust that you ain't just get a white coat like woo, like you actually went and earned it. So you know what you're talking about and I can trust you. That's why we go to who we go to. So, it's still shocking to me to know that people of color will get a doctor of color and still have those concerns about, well, I don't know if I should trust what she's saying, or I don't know if I should trust what he's saying. I'm going to get online and check out WebMD, or I'm going to Google, and I'm going to, so we have two doctors right here for you to ask questions tonight. If you have any questions, if you have any comments, any strong thoughts or feelings about COVID-19, about the pandemic, about 2020, medically, where we are, so many people that we've lost from different types of cancer. We just made it through an allergy season. Seasons are changing. So I think that these ladies are equipped to answer any of those questions. So if you have any, post them in the comments. You can text them to one of us if you know us. You could share it however you need to get to us. you can ask questions. Our producer is standing by and ready to post those questions. So I'm thinking about exposure to the virus for African Americans, and then just for people, period. Once you've been exposed, first of all, let's go back to testing. Let's talk about testing. Some people have had a test where the utensil went here, the tool went about that far. Others had a test where the tool went this far, and they back here looking for COVID. As doctors, are you all first giving the test?
Absolutely.
What are you doing to make me want to let you give me a test in my nose?
What am I doing?
How are you making it easier for people, Dr. Celeste?
Well, I just talk to my patients. I love meeting new people. I enjoy finding out about their story, what's going on with them, how I can service them, and them being better. So a large part of it is connection with them realizing that you're someone that genuinely and sincerely wants them to be okay, that you want their family to be okay.
Yeah.
I take every opportunity I can to educate a patient. And anyone who knows me knows it. If you walk up to me on the street and start talking about whatever, I would, especially if it's about COVID-19, but convincing, I mean, I had to convince some kids today to let me swab them. And there was one little boy who was so strong. He was only 5 years old, and he handled that swab better than 80% of the adults I've seen in the last few months. And he was actually happy about it. And all it took was me, introducing myself, saying who I am, saying, we got to check for these little buggies in your nose and make sure they're okay. Okay. I'm going to take this little swab and stick it in your nose. And he let me do it. So a large part of it is just connection with the patient and them, really seeing that you sincerely want what's best for them. But I'm just a strong proponent, though, of making sure that people understand why it's so important to get the test and why, can't you just do it out there, Dr. Reese? Can't you just do it? No. Everyone who knows me knows that, don't go to Celeste. Medical, right. If you don't know if you have COVID or not, you might not want to come and see.
You want to get back here and find out. I want to see if it's back.
Well, I want it and it depends on the kind of test, because there are a couple different kind of tests that are going on. But the test that I like the most, yes, is the test because it gives me an accurate response, and I trust myself with what I'm doing. You understand? Yeah,
I absolutely understand. I'm going to share something with you all about the test when we get into that a little bit deeper. But a 5-year-old toughing through this test, I've seen grown people and talk to adults who said, "Oh, it's worse than a Pap smear. Oh, it's worse than my recovery from a cesarean." I was like, "What? Who swabbed you?" So, Dr. Kayla, what are you doing to help people with the stomach getting this test? Is there anything special that you're doing?
It's really the same as what Dr. Celeste said. I don't personally swab my own patients. We have mostly our nurses will do it for us, and they're all decked out in all the PPE and whatnot. If we have a patient we think needs to get swabbed. So I have not had to swab a 5-year-old, thank goodness. But, it really is just about, if you explain to people what you're going to do, number one, and why you're going to do it, number two, most people are pretty reasonable and will let you do it. And it really, having that information, again, gives them a little bit more control of the situation, and they don't feel as anxious and as scared about it. So I would say, that's really the main thing, is letting people know and not surprising them. Because I do have some folks who were upset because they got surprised. They did not know how far back the swab was going to go and things like that. So I think you really just have to let people know before you do it. And, sometimes some places are doing one side of the nose, some places are doing both sides of the nose. So you need to let people know, okay, I have to do both sides and I have to go way back there. So that they're, mentally prepared to deal with that, whether they're 5 or they're 100. And so I think that's really the big thing. Most information.
Building a rapport, getting the respect, and let them know I'm here to help and not to hurt. Thank you both for that. So I said I was going to give a little information or just a personal sentiment about the test. So I've been tested 4 times now. The first time, that was the first time. I wasn't there with my nose wide open, just waiting on the swab, but I knew what I was there for. Okay. So the first time was the first time. The second time, I'm a champ. I can do it. It was okay. The third time, which was a rapid test, was the easiest, and I was concerned. The fourth time was when I actually got positive results. So this is my first time publicly saying, because I was actually just in the isolation time. So we're going to talk about all of that. But the fourth time is when they really tested. Like they did a test, like the test of all tests. So I knew then if I got it, you know it right now because you just tested me so great. So the rapid test and then the test that may take 24 to 48 hours. There's a difference in how, to me, there was even a difference in the swabbing. Which one do you all prefer to use and give?
So there's a difference. I just want to make a clarification. There's a difference also with the type of rapid test. So generally speaking, there are basically 3 different types of testing that can be done. One is a PCR test, which generally speaking is the most accurate. The second is an antigen test, which is okay. And then there's antibody testing, which is not accurate for looking for someone who is infected like today. That's gotcha. For later on. But there are rapid PCR tests and there are rapid antigen tests. And so it really matters kind of which one you're getting as far as the accuracy goes. You know, the companies are all a little different. The way the tests are processed are all a little different. So, you know, it's hard to say which one is best, but generally speaking, and I don't know if Dr. Celeste agrees, generally speaking, the PCR tests are the best. Rapid, generally speaking, I think is not as accurate all the time as the ones that take a little bit longer. What I found in practice, some people have a negative rapid one and a positive one when you take the one that takes a few days. So, you know, it's kind of hard because we do want to get rapid results, right? But if we're not getting accurate results all the time, it's not all that useful. But I also think the technology is improving. You know, each few weeks, there's new tests coming out that are a little bit more accurate than the last ones. So what I'm saying today may not be, you know, applicable to 2 weeks from now or a month from now or something like that. So also for people to keep that in mind, it's a really evolving situation.
Okay, thank you. The questions are coming in and I see your questions, but Dr. Celeste, I want you to answer that one. Like, like which one do you prefer?
So if I could have my world, I would have all 4.
Okay.
If I could have my world, but it's not my world. So in reality and in practice, though, I have utilized rapid tests before, but I typically always follow them up with the standard PCR as a form of confirmation, just to make sure. So that shortly we'll be getting rapid tests in my office, but I still want to follow them up with the PCR because I've seen patients who've had a negative rapid test, whether it's, you know, and as Dr. Kula said previously, whether it's, you know, the antibody test doesn't necessarily give you the most accurate information for if you're infected right now.
Okay.
But I've seen patients that have had a rapid PCR and a rapid antigen, and, you know, the standard PCR, which takes the longer, the 24 to 48 hours, has come back positive. So I personally am a fan of, if you get the rapid test because you need it for whatever reason, but let's still wait for that standard PCR before you go get on a plane or go to a public event. Or you understand what I'm saying? And that in that 24 to 48 hours, if you have symptoms, now if you have fever, cough, chills, muscle aches, nausea, vomiting, diarrhea, loss of taste or smell, you should chill at home until the standard PCR comes back. That's what we need you to do.
That's my concern. My concern, and this is where the conversation goes back political. If you have the leader of the free world that is telling you that he only wears a mask when necessary, and we're all wearing it when necessary. But like right now, it's always necessary because what are we learning about how you can contract COVID? Is it airborne? Is it surface? Is it only when you have a fever? Like, what do we know, and why would we not always wear our masks?
So you can. The reality is that all of that is true. You can get, you know, there have been patients where you have been able to trace it back. The reality is the only thing that's going to help COVID decrease is if, number one, God decides, boom, COVID is over, or number two, all of us wearing a mask, because if you'll notice back in June, when everyone across the United States was at home, when they started to open things back up and people wore masks, the numbers started to drop, but they started to go back up when on July the 4th and Labor Day, and at times wherein people kind of congregate. And then we had, of course, the college kids at the beaches.
Yeah.
So, it is challenging to try to filter through all of that when you have someone saying, oh, you don't need to wear a mask at all. Well, that's just simply not true.
Yeah.
It's not true. And that's the socially responsible. If you are someone who cares about the community, you care about this country, that is the socially responsible thing to do, is to wear that mask. It just helps everyone. And even if you don't do it for yourself, if you're not afraid of COVID, someone that you love can die from it. And that's the reality. And so until everyone does that, or until God says it's over, that's what we will be challenged with.
Thank you. Yeah. So until God says, or until we do what we're supposed to do. So washing your hands, hand sanitizer, coughing and sneezing in your arm, staying home when you're sick, wearing your mask, all of those things help. And then you all have also added for us to boost our immunity by using and taking vitamins, vitamin D. Before these two questions that I see on the screen, what are some ways or some things that you can eat or do to get vitamin D? Just a reminder.
So you can have green leafy vegetables are one way to get vitamin D, kale, spinach, things like that. Actually, most green vegetables are going to be good for that. You can always get vitamin D and calcium also from dairy products if you have dairy, or in a lot of cases, it's fortified in other types of foods that are kind of readily available. But fruits and vegetables are always, I think, best, and really green leafy big ones, nice green things are going to be your best bet if you want to eat good stuff. And then a multivitamin, not a diet, right? So you can't live off of multivitamins. So you want to make sure you're getting all that stuff in your actual food. And then you can use a multivitamin to help supplement you a little bit, but I don't think anyone should, unless you have very severely low vitamin levels. You shouldn't just sustain on vitamins as your main source of that. So that's what I'd say. Mm-hmm.
Gotcha. The green leafy vegetables. She said big green leafy vegetables. So go and get you some collards with the big stems. Okay.
Yeah.
Dr. Celeste, what do you say?
I echo what Dr. Akilah shared. You definitely have to make sure that you're eating healthy, that you're eating plenty of protein, and that the vitamins are not to be taken in the place of you eating well. And when we say eating well, we don't mean, the things that won't help us to be healthy. We mean green vegetables, tuna, salmon, mackerel are great sources, as well as actually our bodies naturally convert vitamin D by us spending time in the sun. 15 minutes in the sun has been shown to help with vitamin D levels. So, but wear your sunblock.
Okay. So outside with your sunblock, and inside eating your green leafy vegetables. So now you all have two more things that you can add to preventative measures for COVID-19. Let's look at the political piece of this thing, which is why it's so important that we get out and vote on you can do it now, honestly, but if you want to wait until November 3rd, make sure that you vote, because it impacts medical, it impacts healthcare. I made sure I put my pens on, like, get out and vote, stay 6, all of that. So talking about voting, and you think about healthcare and healthcare for all, a lot of us have heard that. We've heard the plans. We've heard what both presidential candidates are saying. We've seen what the president has done. If I test one time, and I'm just going to say this and use it, you all go with it, test one time at a free testing site and I get results back, and I'm uninsured and I don't know where to follow up. I don't know what the next steps are. I test positive at a health fair or somewhere like that, and I need another test. And my insurance has already, most citizens don't really know what's happening with insurance coverage and the COVID test. So the first test was free. The second one, I may not be covered, but if I am, I don't know what's going to happen with the bill. What does that look like? So what insight do you have on the price of the testing, where healthcare is with covering COVID? Are people just suffering because they don't have coverage, or what speak to it. Whatever you want to say to it, speak to it.
So, I think it really varies a lot based on where you are and what coverage you have.
Yeah.
So it really, really varies. There's not a really, a universal answer to it. But I will say most states now, through their local health departments and state health departments, have testing situations set up so that people who either are uninsured or low income and insured can get testing if they need it. So in most places, if you contact your local health department, they should be able to help you out to figure that piece out. They can also help out with follow-up, right? If you test positive, and it's really the states have and cities have done a lot to try to take control of what's going on, particularly because at the federal level, there's been so much madness kind of going on. There's not really a uniformed response in many ways. So, the state and local officials in most places, and I'm not going to say all, but in most places have been doing a pretty good job as far as making testing available that's cost effective, so people are not having to pay too much for it. You do hear those stories, however, of people who go into a hospital to get a test and come back with some crazy bill. And so that still does happen. But I don't think that's the main kind of story that's out there. I think in most places you're able to get testing if you need testing, particularly with just the nature of what's going on. We know people need multiple tests a lot of times over the several months that all this has been going on. And so I think local and state officials are trying to make it as easy as possible to get people in, to get them tested so that we can stop the spread of COVID-19 in those local communities.
Okay. Dr. Celeste, did you want to speak to that?
Absolutely, I do. I actually am partnering with the Jefferson County Department of Health, the Birmingham City Council, as well as the clergy concerned for the community to provide free COVID testing at Legion Field for any uninsured persons.
Awesome.
So, and we've been doing that since September the 8th, I think is the first day that my medical practice was changed to be the medical partner in that particular partnership. So any patients that I see, and I never, we have people that work for us that put everything in and all of that. So a lot of times I don't know whether the patient is insured or not insured. And to be quite honest, it doesn't matter to me if they are or they aren't. But I follow any patient that I see that's positive. I follow that patient and make sure they have the care that they need. The follow-up, because once you're positive, you don't need to just go off the grid. If you are positive, you do need follow-up with a physician to make sure that you are okay from alcohol. And that's very, very important. And we need to make sure that we don't skip that step. The only thing, and so that if there's anyone literally in Jefferson County that is in need of testing and is not insured, please come to Legion Field. We'd be more than happy to take care of you and those needs and making sure that you're followed beyond that.
Awesome. So let's talk about that part of it. Once you've been diagnosed as positive and you are told to isolate, hey, go to your house, don't come out. How long should you go? I've heard 10 days. I've heard 14 days. What do you all suggest?
So when I get COVID positive patients, I've had them all stay, I recommend 14 days. Now I do share the recommendations of the CDC with every patient because that's just in general what the recommendations are. But most of the time my patients will ask me, what do you think? Like I had a patient to ask me today, I'm not having any symptoms. You mean I have to stay in and blah, blah, blah. And, on and on. And I'm sure that Dr. Akila will share that same conversation. I'm sure that she has with her patients. And that there's a challenge for some people to understand that they're sick and they're infectious because they're not having symptoms. And so that in and of itself is a challenge. But at the same time, we just want to make sure that people are followed the way that they need to be followed, and to make sure that people that don't have insurance are tested so that they're not taking this and spreading it throughout the community. And it's so important for people to get that portion of it. But I want to stop so that Dr. Keela can share.
I agree 100% with Dr. Celeste as far as the recommendations for quarantine or isolation after you've had a positive test. One hard thing with COVID is that it's still evolving, right? And so we don't have all the information. And I think, that the isolation recommendations change from 14 to 10 and then to 14 to 10. You know what I mean? It's hard to say exactly what, but for me, I think safe rather than sorry. So let's stick with 14 at a minimum. And I, again, 1,000% agree as far as making sure you're following up with a physician or a healthcare provider to make sure you're okay. And to really use any resources that are there if you are uninsured or if you're low income and just have a hard time, paying for those out-of-pocket costs, to make sure that, we're keeping everyone safe, keeping individuals and families safe and our community safe.
Wonderful. So we have a few minutes left, and I do want to get in about that aftercare and thinking about our community and being taken care of. We now know where we can go and get tested. You have now heard from 2 great doctors who are working actively in the field, and we're finding out that follow-up care is imperative, that you are under someone's care after being diagnosed with COVID-19 and that you're staying in for at least 10 days, but recommended 14 days. When are people contagious? Is it when they have a fever or if they have a fever, or do we not know that part yet?
So it depends on when they contract the virus. The way that we get COVID is the virus goes into our nose, it embeds in our cells and replicates itself. And that's why, so for some people, when they get it, it may take some people a little longer to express the virus and for it to be picked up via a test. And so for that reason that it takes a little bit longer, and I'm getting distracted by the comments on the side and trying not to, but once we know that that someone is positive, we know that we want them to stay in for the 14 days. We also know that they need aftercare. It's very important for us to make sure that the other people that we've been around and we contact trace back to make sure that those individuals that were around you have been tested. And a lot of that has not been happening. I'm gonna stop and let Dr. Keela share on her end, but that is an issue. And that's one of the reasons why it keeps popping up and why some people come in and say, oh, but I'm not having symptoms. So when you have the fever, are you infectious? Yes. Just because you don't have a fever does not mean that you're not infectious. I've had so many people tell me that, oh, but Dr. Celeste, I didn't have a fever, so I thought it was okay for me to go out or go do this or go to the barbecue and go do it. No, it is not. Until we get that test result back, we need you to quarantine. And if you have a positive result, doesn't matter if you're having symptoms, you're shedding the virus. There's a 72-hour period where you shed the virus primarily, where you're the most contagious. But what that looks like on each individual patient, a lot of times looks different.
Okay, thank you for that. So much information here. Dr. Akila, wrap us up on that one.
Yeah, no, absolutely. So we know asymptomatic people can spread COVID-19, and you don't have to be sick. You don't have to be in a hospital. You don't have to have a sniffle. You can just be completely normal and be infected and spread it to other people. And so I think that point is one that we need to drive home. If you've had a contact, even if you're asymptomatic, but you've been in contact with someone who has COVID-19, you need to get tested, because you could still have it and you could still be spreading it to other people. As far as contagious, we know asymptomatic or pre-symptomatic people can be contagious. In the same way that, people who have symptoms can also be contagious. The level of contagion is a little, we're not 100% sure. I think the science is evolving there, but we do know that can happen. And the last thing I'm going to say is about children and kind of children and how contagious they can be. We do know that kids can tend to be more asymptomatic than adults are, or to have less symptoms than adults do. Yet we still know children can pass it along to adults and to other children. And so we also need to make sure we're keeping that in mind. It's everyone from the little kid in elementary school all the way to grandma who could have this thing, who could be spreading it about. And we just need to make sure. The big thing really is testing. If there is a chance that something's going on, and then also wearing a mask and socially distancing as much as humanly possible, so that we're, decreasing the amount of spread in our communities, in our families, and in our close contacts.
Wow. So thank you all so much for reiterating the things that we already knew, and then for teaching us some new things that we can start implementing immediately about our diet, about social distancing in your home, Getting some sunshine, a few minutes of it, but making sure that you wear your mask, even the difference in the different types of tests. So we did learn a lot in this time. I hate that we can't go longer. We'll talk to Woke Vote about bringing us back together again, ladies, so that we can do this some more. One thing is for sure, COVID-19 has definitely been politicized, and it's been politicized in one of the most interesting eras in American politics ever. So because of where we are right now, when November 3rd comes, a lot of people are going to, get their chairs and line up and go try to figure out how to vote on that day. But it may be wise for you to go ahead and do what you need to do now so that you can avoid the large crowds. You can avoid waiting in line. You can avoid being exposed to COVID-19. You won't have to leave the polls wondering if you should go and test, because you can test early. You can vote early. So be sure to get the information for whatever area it is that you live in by visiting the Vote website. Find out all information voting related there. If you have any other questions, make sure you hit them up on any social media platform and ask the question so that you won't expose yourself to COVID-19 trying to do the right thing. You can act early and avoid all of the issues that come with social distancing and people not wearing masks and not staying back, and vote early. I am Lady Wu, Dr. Celeste, Dr. Akila. Thank you all so much for your time tonight. Thank you for everybody who joined us. Before we go, can people follow you on social media?
Absolutely. They can follow me on social media at drcelestemd.com. It's DoctorCelestemd on all social media handles.
And you can follow me on Twitter at Dr. Akila J, or Instagram and Facebook at Akila Jefferson MD. So AKILAH Jefferson MD.
Wonderful. And I am Lady Wu at Watch Wu Work. So watch me work. Let's have these conversations. Let's get our people registered to vote. Let's get them connected to people who can help them. Woke Vote is doing an awesome job of that. So be sure to stay in the know so that you can know which way to vote, which way to go, and what to be a part of. Enjoy the rest of your night and stay woke.